My name is Robert Patterson. I am a general surgeon. I work at American Fork Hospital. I'm a Canadian, so most of my schooling was done up in the Great White North. My undergraduate was done at Simon Fraser University in British Columbia. I went to medical school in Calgary, Alberta. I did a rotating internship on Vancouver Island and then did a 5-year general surgery residency back in Calgary again. I then followed that up with a 2-year fellowship in the field of medical informatics at the University of Utah. When I started medical school, like a lot of medical students, I wasn't really sure what I wanted to do and sort of made up my mind as I went through medical school. I was very much impressed with the fact that general surgeons were problem solvers. And by that, what I mean is a lot of medicine consists of chronic disease that you manage, and you're seeing the same patient over and over again for their hypertension or diabetes, and that's very important. It needs to be done. But what interested me more were the acute problems like appendicitis or trauma or things like that, where you could intervene once in a very sort of profound way when you operate on someone and cure that problem, and that problem is cured forever. There's a number of things you have to consider when you're dealing with a patient. First of all, the patient's scared, or at least anxious. You're meeting with a surgeon. This is a guy or girl who's going to cut you open, and that's kind of a scary thought for a lot of people. They're all hoping, of course, that they have an easily identifiable problem, that we'll be able to manage it, and that they will be better afterwards. Unfortunately, that's not always the case. When it comes to surgery, I sort of have a dual approach. Number one is a surgeon should be technically proficient. He or she should be very well familiar, of course, with the anatomy of the body, the operative approaches, the healing process, that sort of thing, and be a technical wizard, if you will, and more than adept at the manual aspects of surgery. The second part, though, is a surgeon has to have empathy. You have to realize that your patients, as I said, are somewhat nervous. You have to understand that you have to deal with needs other than their anatomical needs. You have to deal with their psyche, what their concerns are, how this surgery is going to impact them. You have to talk to their family members. You have to understand you're going to be giving them pain, and you have to talk to them about that and the recovery process. By coincidence, sheer coincidence, the two most common procedures I do are gallbladder surgery and hernia surgery. And as it turns out, I've had my gallbladder out and I've had my hernia fixed. So I'm able to relate to those patients because I've gone through those operations myself.